Climate change doesn't just affect the world's health, but our own personal health as well. The combination of rising temperatures, but also air pollution, is affecting our lungs, our hearts, and even our brains.
Elderly people and infants often struggle in heat waves. Hot conditions are also associated with physiological changes, with changes in the way people's circulation and heart functions. Increased heat waves, increased flooding at times, increased drought, increased severe weather events, air pollution brings together humans, animals and the environment in different ways. An example was when we had flooding in southern New South Wales and northern Victoria. It was associated with increased mosquito breeding, changes in bird migration patterns because of climatic factors. It resulted in an outbreak of an infection called Japanese encephalitis. I'm seeing new infections emerge in Australia that have never existed here before.
Several areas in Makassar experience with flooding every year. Thousands of people are displaced. They destroy their properties and they live in the temporary shelters. Students have difficulty to go to schools. Pregnant women have difficulty to get access to hospitals or any health services. They have difficulty to buy some food, and also the area, the environment where they live are heavily contaminated.
The health of Pacific Islanders is being drastically affected by climate change. At a physical level, people's access to nutritious food is being affected by increasing cyclones, which are wiping out croplands, or by rising sea levels, which is affecting the quality and quantity of fish and the quality of soil. But climate change isn't just affecting their diets. People's mental health is affected as well, with many suffering from PTSD, adjustment disorders, depression, from the stress and culture changes that are being brought on by people having to uproot their lives.
And all of that will be fixed by simply reducing our emissions. Our lab works on using microbes as part of the solution to that. And when microbes are used correctly, they have these superpowers that allow them to remove 350 million tons of climate-active gases from the atmosphere. We're also working with the agricultural sector to reduce emissions of methane from cattle. Our field trials have been investigating how SEDN inhibitors are able to not only reduce methane, but also in some cases feed into production as well, thereby resulting in an increase in both sustainability and productivity. Our work is starting to have a really promising impact, and if we can scale up these solutions, we'll be able to significantly reduce our global emissions.
To address a problem in informal settlement, we design an intervention we call green infrastructure. We collecting black and grey water from the households, and then we treat it before we release it into the environment. It will be a prototype for increasing the health, or particular environmental health, in Asia-Pacific regions.
In the Pacific, they're banding together and building resilience is really quite remarkable. People are increasingly drawing on traditional practices by reviving the art of building sustainable boats. They're also setting up coral restoration sites to bring back fish to the islands. They're also trying to restore their mangrove population around the Pacific.
At Monash, we're bringing people together through the Health and Climate Initiative to work collaboratively to tackle this urgent planetary health issue.